Good evening, folks. Tonight's topic is managing your pain at home. Now, this is very easy for some people. Um, this means, taking over-the-counter pain meds, icing it down, elevating, wherever you're injured at. So tonight we're gonna go over the do's and don'ts of home pain management. So, hope everybody's ready. Okay, first, let me adjust my camera. Does it look better? Okay, it is essential for improving your quality of life. While it is critical to work with a doctor, there are several options you can explore. Okay, first one on the list is medication. Now, these are over the counter or OTCs, such as Tylenol, ibuprofen, acetaminophen, or non-steroidal creams, anti-inflammatory drugs, and NSAIDs like aspirin, ibuprofen, or naproxen for milder pain. Topical pain creams, lotions, or sprays applied to the skin can help with sore muscles or arthritis. Okay, second one down, prescription meds. Now, these are OTCs. These are what you get if your over-the-counter doesn't work. You go to your doctor and you get something stronger. So we will delve into that one right now. If OTC drugs don't suffice, your doctor may prescribe stronger options such as muscle relaxants, analgesics, or a short course of stronger pain killers. Okay, so basically, if your over the counter doesn't work, like if you run to the store and get some ibuprofen and you take those for a couple of days and it doesn't work, then my suggestion to you is exploring maybe going to your doctor, getting something stronger, something along those lines. Now, if those don't work and you're still having major pain, like on a scale 1 to 10, let's say it's a 10 and you're still screaming pain, then you go get the nerve blocks and injections. Now, there's a difference between nerve blocks and injections. Now, nerve blocks, those are given to a person via like IV line stuck in the space between your spine and the discs. Steroidal injections. Uh, lim- limit limit limited injections at the joint sites can reduce some inflammation and swelling. Now those are temporary. Those only last maybe 6 weeks to a month, and then people are basically back to square one. Um, so then here you go with self-care techniques. Some people like these better than meds, which are rice method, rest, ice, compression, and elevation. Can help manage injuries to bones, muscles, and soft tissues. Second technique for self-care is mind and body techniques. Explore. Now these are natural techniques. Some people can go for um yoga. Some people do meditation, relaxation techniques, um, and mind. And there's also a third one that people do is called mindfulness. Let's see. And then the third, the let's see, one, two, three, four. Fifth one is your classic standard physical therapy. You go to the doctor for a script, and he gives you a script for therapy, which means you go for maybe 30 days, and then they can do extensions for you and get you another 30 days. So you're sitting in the PT room for 60, trying to relieve some of the pain with that. And then we have the Chinese method, which is acupuncture. Acupuncture. Some find relief through acupuncture sessions. Now that's where they stick needles, like just they're subcutaneous needles. They stick needles into your body for acupuncture at the point where at your points of being sore, where your soreness is. Okay, so then there's also the last one is lifestyle changes. This means a person prioritizes sleep and avoids smoking, and maintain a healthy diet. Remember that chronic pain management often involves a combination of approaches. Healthcare, consult your healthcare provider to create a personalized plan that suits your needs. So basically, if nothing you try helps at home, your last resort should be see a physician for a script for PT, or maybe somebody's having pain in their hands, so then you go for a script for OT, which will help you with basically with the same idea as PT, but it helps with your hands. That was tonight's episode. Next episode is let me get the notes and I'll tell you. Oh, arthritis. Next episode later is arthritis, going over each one of the stages of arthritis. So hope everybody sticks around for the second one later, which will be probably about 9 or 10. So I'll jump back on here with the second episode. For now, this is Gator Wellness signing off. Everybody have a good evening. Thanks for watching. Like, share, and subscribe. And if anybody has any comments, leave me comments. I will get back to you as soon as I can. Thank you.